If you are on a medication for weight loss, here are a few things you must keep in mind. Hi, and welcome back to my channel. My name is Dr. Meghan. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel provides evidence-based answers to your weight questions. I've helped hundreds of patients lose weight, and I can help you too. If you want to work with me directly, I'll leave that information at the end. Today, we are going to talk about what these medications can't do, because when you hear about them on the news or social media, it really sounds like they can literally do everything. And I think it's good to just take a step back and give some perspective on what they can do and what they can't do. Let's take a common scenario. Let's say I have a patient who weighs 200 pounds. Their goal is to get to 140 pounds. Now, even if they're on the most effective medication, which would be Zepbound, where patients can lose about 20% of their total body weight, that's really only going to get them, if it's working, if they're falling into that average category of patients who respond, it's only going to get them to 160 pounds. And they have to stay on that forever. So it's, very exciting when patients are losing the weight, and then it's going to plateau. And that's, generally around where I would expect that patient to be long-term. The end result of that medication, their new normal, would be around 160 pounds. So if that patient wants to get to 140 pounds, you have to add something else. And you have to either add another medication, you have to change something lifestyle, you can do both. But you do need to add something else. I'm not expecting the medication to get them from 160 to 140 if they've really plateaued at that 160 pounds. Let me say first that the GLP1 agonists are amazing. They are such a wonderful tool for so many patients that we didn't have before, and they really are incredible. But they can't do everything. And so sometimes I have patients who come in and they say, well, I'm taking the medication and it stopped working. But it didn't stop working, it's only going to take them so far. So it's important to just take a step back and look at, what these medications can do. They can help you lose 15 to 20% of your total body weight. That's incredible. But also what they can't do. So, if you're somebody who's eating ultra-processed foods, and your cravings for that haven't really subsided with the medication, they don't stop you from doing that. So they don't stop people from eating ultra-processed foods, although they might become less palatable for patients. They don't help you drink more water. They don't keep you from being sedentary. Now, definitely as patients are losing weight, there's certainly a positive momentum towards exercise. It's easier to move around, it's easier to exercise. People are noticing changes, so it's easier to commit to those things, but they don't necessarily keep you from being sedentary. They don't lower your saturated fat intake. Now, if you are eating less, that's going to lower your saturated fat intake, but they don't always affect the quality of the foods that you're eating. They don't help you eat more plant-based proteins. They don't really affect the quality of the protein that you're eating. And again, a lot of times patients feel more compelled to eat healthier foods, but it's not 100% of the time. They don't make you exercise, right? They don't make you get to the gym, and they don't make you exercise properly. So sometimes when I'm talking to patients, especially about strength training, we're walking through what good guidelines are, and they say, I have these 1 to 3 pound weights and I use them at home and I'm using them, when I'm walking, and that is not strength training. I'm always glad when people are starting somewhere, but lifting a 1 pound weight, that's really not going to get you muscle growth. So they don't help you lift weights, and they don't help you lift weights properly. They don't help you plan your day. They don't help you plan your day so it's more health promoting. They don't help you meal plan. They don't help you schedule your exercise sessions. They don't do any of that. They do help with weight loss, but there are so many other changes that are good for people to make that the medications don't do. So this video is really just to highlight that the medications are one tool, but to really get the greatest benefit, to really get to your goals, to get to where you want to go, don't depend on the medication to do everything. Medications are one tool, and weight gain is multifactorial. And so weight loss is going to have a lot of different elements to it as well. And sometimes a tool is like a Swiss Army knife, but even a Swiss Army knife doesn't do everything. Now, they certainly help with so many things, these medications. They help with cravings, they help with appetite, all these things that I've made a million videos on. They really, really help. But they just don't do everything, and these are the other things to keep in mind. Thank you so much for watching. If you want to work with me directly, if you're in Massachusetts, if you're outside of Massachusetts, I'm going to leave that information down below. If you're in Massachusetts, you can be a patient of mine. If you're outside of Massachusetts, I do also work as a life coach, and I help people with goal setting and habit formation. So I'll leave that information down below. Thank you so much for watching, and as always, please be well.